My name is Mitchell Valdes-Sosa. I'm the director of the Cuban Center for Neuroscience. Usually do work on neurodegenerative diseases and childhood disorders of the brain, but lately we've been using the technology we have here to manufacture equipment and different materials that are needed in the COVID response. So I hear people saying the embargo has no effect on the Cuban health system, and this is not true. I can give 3 examples from our own work. So the third thing is that Cuba traditionally has imported its own ventilators. There were these Swiss companies that used to sell to Cuba ventilators, but they were acquired by US companies, and they said that they couldn't supply anymore to Cuba. So our government decided on manufacturing ventilators, emergency ventilators, and we were buying raw materials to manufacture. The ventilators we're manufacturing, the best motor is from the US. We cannot buy it directly from the US. We have to go buy it from somebody that buys it from somebody and that buys it from somebody. And this makes it more costly. It takes longer to get here. The second example is we're manufacturing the swabs that are used for the PCR tests. And we wanted to buy a packaging unit from a German company to automatically package the swabs. Everything was going okay until Cuba was placed on the list of countries that sponsor terrorism. And this German company just said, we can't sell it to you because it's too complicated for us. It'll get us in trouble with the US. And they simply dropped it. We had to start searching for another supplier and go through all the process, and that can take months. The third example is that we also started manufacturing here in the center surgical masks. And we had a sale in Europe of this material lined up to send to Cuba. And just a few days after all these protests, they decided to double the prices. And I think this was politically motivated. This is an indirect effect of the embargo, and we finally decided to buy the material in China, but now it will take a few months to get here. The embargo is costing lives because Cuba has an excellent health system, despite whatever the US propaganda can say. And if it were able to work at full capacity, it would save many lives. Lift the embargo, and that's the best help for the Cuban people.